So every morning we are putting your questions about COVID-19 to health experts. And today we are joined by Dr. Zain Chagla from St. Joseph's Hospital in Hamilton. Good to have you with us again.
Hi, thanks for having me.
All right, our first question comes from Allison. She writes to us on Instagram and she wants to know, what kind of medicine should we have stocked in our homes in case we have a mild enough case of COVID-19 that we can self-treat?
So generally, I would say the same thing as what you would have during regular cold and flu season. So, if you remember during regular cold and flu season, we have lots of fluids at home. We make sure we have access to really nutritious food. And then sometimes some medications just to relieve symptoms. I think the most common thing people take is Tylenol, and very reasonable if you don't have any issues with taking that. I wouldn't necessarily recommend any other cold and flu preparations, but just having fluids, Tylenol, and just a good supply of your home medications for other issues that you're being treated for.
All right, good advice. We are hearing that some people can carry the virus, not be showing any symptoms. So one of our viewers wants to know, how long can they be a carrier of the virus for? This is particularly important because we've had an influx of travelers come in from other countries, including the U.S., where there have been several known cases of symptomless carriers.
So it's certainly known that again, people without symptoms can actually shed the virus and then be transmitting to others. There is some data emerging out of Germany that it's still really the amount of virus you have often does also correlate to your symptoms. So people with no symptoms do shed a bit of the virus, but it's not as much as people that have very mild symptoms, which shed a bit more virus. And then the people that are sick and end up in the hospital shed much more virus. So the average mild case sheds for about 8 to 10 days. Usually once symptoms resolve, about 48 to 72 hours afterwards, they tend to settle down. And so those asymptomatic cases may shed for some time, but probably less than that 8 to 10 days that even the mildest cases shed.
And doctor, just to clarify, when you're talking about shed the virus, you're talking about droplets through things like mucus or sweat?
Yeah, so droplets through sneezing and coughing, or mucus or nasal secretions kind of getting on the environment.
Celia on Instagram wanted to know, if we manage to flatten the curve, how long after will physical distancing be continued? Do we have to wait until no new cases are reported?
Yeah, it's interesting because these are obviously unprecedented times and unprecedented measures to control the virus. And I think that's the biggest question that comes to people's minds. These measures will work, but they need to be sustained to work. And so I think it's going to be, the example of Wuhan, where they're having very minimal cases, they're still practicing some degree of physical distancing to make sure that re-influx does not happen. And so we may, when we get to a point where cases are flattened to their lowest numbers, we may de-escalate things, but it has to be a very careful, slow, and methodical process. The other part is travel, and what we're doing in Canada doesn't necessarily reflect what's happening in the rest of the world. And so people coming back into Canada will still be a risk factor for re-spreading the infection within Canada. So as much as our physical distancing in our day-to-day lives may start to reduce as things get better, we still may have very strict restrictions on travel going forward.
I know, as you point out, this is an evolving study that we're doing, and so the answers can change. But we appreciate your time this morning, Dr. Chagla, and we appreciate our viewers sending in our questions. We're going to do it every day at this time, so please continue to send them in. Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.